Hi, my name is Tom Douglas and today is 20th September. Today I'll be demonstrating various airway skills such as inserting an oropharyngeal and nasopharyngeal airway, using the laryngoscope and the bag valve mask, and also placing the patient into the triple airway manoeuvre and in the lateral position. Firstly, I'm going to insert an oropharyngeal airway, or an OPA. The purpose of this is to keep a patent airway by depressing the tongue and stopping it from occluding the oropharynx. To do this, I'll prepare the patient in the triple airway manoeuvre as I demonstrated before, and choose the correct sized OPA. To do this, I'll measure it from the corner of the mouth to the angle of the mandible. I'll also make sure it's well lubricated. To insert the OPA, I'll insert it with a natural curve facing the opposite direction, just like this, nice and gently. Once it's halfway in, I'll rotate it 180 degrees and gently slide it most of the way. That's pretty much it. Common error is to choose the wrong sized OPA and also not turning 180 degrees when you got it in. If for some reason the OPA is not able to be used, I'll use a nasopharyngeal airway or an NPA to also ensure that the tongue doesn't fall into the oropharynx and include the airway. Firstly, I'll make sure the NPA is the right size. I'll do this. I'll just measure it from the tip, from the nose, down to the earlobe, and this size seems to be appropriate. Also, I'll make sure the diameter of the NPA is correct and not too big, and also check the nostrils aren't blocked by anything, and they seem to be good. To insert the NPA, I'll throw the tip in, just make sure it's pointing posteriorly along the floor of the nose. I'll insert it in and just gently start twisting 45 degrees until it's all the way in. I'll now apply positive pressure ventilation to the patient to ensure that the unconscious patient is getting oxygen around the body. Firstly, what I need to do is correct the correct size bag and face mask, and this seems like the appropriate size for an adult. Also, I must ensure that with this face mask, I get an appropriate seal around the mouth and nose, make sure no air escapes out. To prepare the patient, I want him to be in the triple airway manoeuvre, as I demonstrated before. I'll also insert OPA to ensure that its tongue won't fall into the oropharynx. Just like that. I'll now ventilate the patient. So make sure I'm getting the correct seal, the right seal, no air escaping. Just gently squeeze the bag. As you can see, the lungs are filling up, the patient's being ventilated. Now clinically, I would ventilate the patient at a rate of 12 ventilations per minute, and it's kind of like this. So that's pretty much it. That's how you ventilate a patient. Just make sure you don't fall for common errors such as maybe having a bag that's too big might overinflate the lungs and cause damage, or choosing the wrong sort of face mask and not getting an adequate seal. You're sort of like, letting air escape like that. I'll now inspect the patient's upper airway for any foreign body air obstructions that may be around the vocal cords. I'll do this by performing a laryngoscopy. Chooses this, the laryngoscope. Firstly, I'll make sure the laryngoscope is in working condition, the light bulb's on, everything's secure, nothing loose. Also, make sure the patient is in correct position, pillow under its head. Before I pass the back, sniffing position, make sure the jaw is open. I'm now ready to perform the laryngoscopy. Firstly, my right hand, I place it there, pulling the forehead back, and making sure that I'm holding the laryngoscope my left hand on the beat. And now it's making sure coming down the right hand side of the mouth, and the tip of the laryngoscope is along with the molecular groove of the tongue. Now, to make a proper inspection, I must lift the laryngoscope up along the axis of the handle, out like this. Now we're looking at the vocal cords. Let's also make sure that when I'm actually doing all this, I'm not angulating it all, like this. I can cause some damage around the vocal cords or chip some teeth. I'm now going to put the patient into the triple airway manoeuvre. This is aimed at pulling the attached tongue forward and away from the oropharynx and clearing the airway. Firstly, I put the patient in the sniffing position. This involves head tilt and a chin lift, opening the mouth and pulling the tongue forward, and finally a jaw thrust, which is aimed at displacing the tongue anteriorly and clearing the airway. To do this, place the fingers along the angle of the mandible, thumbs on the zygomas, and just thrust with your fingers upwards and forwards, just like that, and that's it. Now I'm going to put the patient into the lateral position, and this is to assist in stopping the tongue from pulling at the oropharynx and also allowing easy drainage via any other obstructions such as vomit. First, I'm going to check the patient's pockets, and they're clear. Also, the area I'm going to roll the patient into is also clear. And I'll start. Bring the firearm at 90 degrees, near arm across the chest, bring the nearest leg up, flex at the knee, and now I'll roll the patient gently over by holding the patient at the hips and the shoulder. Gently over, pulling this arm up like this, tilting the head, and now the patient's in a stable position.